Anytime you have a reduction in force, it's painful, it's ugly, and it's certainly not what any of us want to be involved with. As we go forward, it is necessary for us, in order to preserve the care, that we are financially viable in going forward. And for the reasons we've talked about in the past, conditions have changed and it requires us to consolidate. As we do that, and as we have seen many of our services decline, it's important that we adjust to those changes and reduce our costs. Most recently, it was announced that we removed 40 individuals in a reduction in force. Actually, it was 40, what we term as FTEs, or 40 positions. What that means is that as people leave, we don't replace. Now, out of those 40 positions, and any individual losing a job in these circumstances is not good. Out of those 40, we had 9 individuals leave. And it was through attrition, through shifting, through transferring, identifying essential positions that we need to go forward, and then adjusting accordingly. But out of the 40, we had 9 individuals involved. Will there be additional reductions as we go forward? Yes, but we tried to do it in the most sensitive and fair way possible.
What's the future hold in that regard?
The actual end result depends on, as we finalize the planning process, we will better know what the services configuration will look like, and we'll better determine how that will affect the employees.
So you're not saying no, but you're not saying yes either at this point?
Well, there will more likely be reductions still coming, but again, through attrition as people leave, not replacing. We're going to do whatever we possibly can, as Cynthia says, to soften that as much as possible.
But there will be other reductions.
Yep.
I think we have to realize that there will be other reductions. We have to reduce expenses. And every business in this county has probably looked at their employee statistics and decided that they needed to reduce employees at some level. On page B4 of our local newspaper today, there was a very small article about another healthcare institution in the Hudson Valley who had a reduction in force as well. So just remember, this is healthcare, and it's the challenge we all face. And we will have reductions. We have to have reductions. We have to become more efficient. We have to become smarter, and we have to reduce our overhead to preserve what we can in this community.
Dr. Cashin, not to put you on the spot right away, but you are in charge of the medical staffs at both facilities right now. How have these overall layoffs impacted the delivery of health care on the part of medical professionals?
The layoffs have not really affected healthcare at all. None of the medical professionals that deal directly with patient care, I believe, have been laid off. If any have left, they've left on their own accord. I do not believe any layoffs affected any healthcare workers that had direct patient contact, so in that case, it really didn't affect how the medical staff interacted with the patients or the nursing.
That leads me to the next question, which I think you brought a couple of posters with you tonight that I want to give you a chance to direct people's attention to. What's been going on with external review of the hospitals during this tumultuous time? How have you been faring with external reviews?
We've fared very well. We've included some posters just for your review, just to highlight some of the skills that we have and the accreditation and the awards that our healthcare team has achieved in the recent months. So these are for your review. It does reflect the work of excellent physicians and excellent caregivers on our team to support the level of care within our organizations. And so I encourage you to look and to follow the quality. We continue to receive awards. We have a handout as well with the latest acknowledgement from the Joint Commission on Accreditation of Hospitals, acknowledging our hospitals as in the top 15% of the country. So I would encourage you to look at it and appreciate the work that goes into this. These awards and certifications don't occur by accident. It's due to the excellent work of the people that we have.
That's a reasonable transition to the next question. It's impressive to see that you're still getting good reviews from external review sources. How about from your bookkeeper? How are you doing financially?
We are not viable as an organization financially at this point. And that drives, as Cynthia has talked about and as we've talked about previously, the need for us to continue to right-size our organization. And we feel that we can, within a single facility, be able to provide the level of care that's needed at far less cost.
When you say you're not viable, Mr. Lundquist, how does the fiscal health of the hospital compare today to when you entered into this phase where you're starting to look at changes to be made? Is it improved? Is it the same? Has it worsened? Will it cause any changes in the plans that you have or plans that you originally had to go forth with changes with the Department of Health?
For the last several months, we saw several indicators of the drops in volume and the drops in reimbursement. And we've been taking steps over the last several months to evolve and to accommodate those changes. And as we go forward, we will continue to make those changes as we need in order to accommodate a financially viable organization that can better support the ongoing delivery of care.
And the last question in that line of questioning has to do with the status of the Health Alliance vis-a-vis the State Department of Health. Can you give us a status update about what's going on with the Department of Health?
I know that's been a point of frustration because we've been asked to provide the final plan. What I will say is the last 4 months have been very intense. We've looked at all phases of our operation. We've met with the Department of Health physically twice. As everyone knows, we indicated our preference as to accommodate as many services as possible as the facility on Marys Avenue. And there are 2 things that are needed in order for us to finalize the plan. One is access to the property, and the other is access to funding that will help prepare that facility to handle the services. And the reason we can't divulge or share with you the final plan is that it's not final until we answer those 2 questions. At that time, we can better then define what that plan looks like.
Cynthia, you look like you want to say something.
I would say that from my perspective, I think the Department of Health has been very supportive in being interested in what's going on in our community, very supportive in understanding the need to consolidate. And I would like to just address the fact that they are supportive and understanding of that because consolidations like ours are going on across the state. And in fact, I think that we probably are in the 2nd or 3rd level of their attention because their attention in the Department of Health is being taken by those organizations within the state who are in bigger trouble and have less cash and more financial concerns than we do. And so they have, I mean, in their own words, they indicated that there were many train wrecks out there that they were dealing with. So I hate to say that we look better in comparison, but I will say that there are many who are in a lot worse straits than we are. Does it make our situation easier? It doesn't make any of us in this room happier, but it does take the Department of Health's attention away from us to some degree. We are not their only issue. We are not their only organization going to them, asking for guidance, asking for insight, asking for money. There is a line ahead of us. And so I think we have to be patient. And believe me, patience is not my strong suit. Ask David.
I agree.
And so we have to work on our patience and understand that we may, as a community, be forced to do many things on our own without the assistance from Department of Health, not because they don't care, not because they're not interested, but because they have many, many other healthcare facilities in this state that need their help as well.
Kevin, would you agree that Cynthia Lowe is not a patient person? I'm only making a slight joke there. I do want to know the perspective of the board as to what's been going on in the past couple of months. Ms. Lowe has been in part of these forums, and she's expressed her views publicly here on radio stations and interviews elsewhere, but we haven't really heard from the other members of the board. How does the board feel about what's been going on, both in terms of public input and the decision-making process and things that you're facing?
I think the board has been completely supportive of leadership and certainly of our chairperson. The board is trying to get through this like everyone else in the room. The Department of State, the Department of Health, as Cynthia said, has a full plate. And that's a little disheartening on many levels, but for selfish reasons for us here. We're not the only one up there knocking on the door. But I would say the board collectively is in full support of the executive team, of the employees of the hospital, and it's just some tough, rough sledding.
I think, Mr. Lundquist, you touched on this, and you don't necessarily have to be the one to answer this, but I'd like to have someone enunciate the reasoning behind what some have perceived to be secrecy in the process. You've alluded to several times a plan. In my view, I get a vision in my head when you say a plan. It's a bunch of papers that are bound together, indexed with tabs on it, and you refer to appendixes and all kinds of this. To me, that's a plan. At least when I was in the healthcare business, that's what the central government in Towson, Maryland called a plan. There are about 22,000 pages of it. Is that what you have? And if it is what you have, why are you not sharing that with the general public?
The plan that you're talking about would be the CON, or the Certificate of Need application that would lay out that detail of plan that you're talking about. What we have are different models looking and projections and financial budgets, et cetera, that are needed in order to accomplish the establishment of as many services as we possibly can. It's based on a lot of assumptions and things that are estimates, simply to provide some structure on what does it look like going forward, what are the services, what the service configuration looks like, and then from that point, once we get, as I said earlier, the decisions that we're looking for, then that will determine how much of the plan or the preliminary information that we can actually put on paper.
In the middle of what you just said, you used the word assumption. What's an assumption? And why can't that be made public? Why is it not something that we should all chew on?
Well, it's dangerous to share assumptions because they're not fact. And particularly when you're dealing with emotional issues that affect a community like this, it's very important that we deal with the facts. And as we firm up those assumptions, we can share the facts.
So an assumption is a building block that you're using to make a decision, but it's not necessarily something that's carved into stone or real. It's ipso facto maybe.
It would eventually get to a plan, but it's preliminary at this point.
The next question that I have is, I guess the appropriate person to answer would be Cynthia Lowe, since you serve a dual capacity even here at this forum. That is, what's going on with the Foxhole Ambulatory Surgical Center?
As we've indicated before, Foxhall is not financially viable. Currently, there are very few procedures that are necessary to be done at Foxhall. And unfortunately, we've had a rather mundane problem with a piece of equipment that we are attempting to replace or repair. And we're in the process of trying to get that done. So as a result, our physicians do have privileges elsewhere, so the community still is being provided the services that they need. but they are not today being provided at Foxhall because of an equipment issue.
What about the provider issue that we've heard a little bit about in the past?
Well, the provider issue, if you're referring to a physician who will do terminations, that is not something that Foxhall ever committed to doing, which was providing or hiring a physician to provide any services. The commitment on the part of the people who built, those of us who built Health Alliance and as a result built Foxhall, the commitment was to provide a location for services to be provided, not to provide the physicians. And I think that that's a distinction that we all need to understand. And I think there's some confusion based upon where we are in the continuum of healthcare. 5 years ago, when we started talking about Health Alliance and Foxhall, there were very few employed physicians. Most physicians had their own practice, or they were in a practice with several other physicians, and they worked independently, and they referred business to the hospital, and they were credentialed at the hospital if they were surgeons to perform procedures at the hospital. Over the last 5 years, that continuum of healthcare has changed, and many physicians are now employed. I will tell you that at Health Alliance, because of our financial constraints, we hire very few physicians, certainly infinitesimal number compared to those physicians that are hired in other healthcare facilities in the Hudson Valley. And so we have not committed and have never committed on the part of Health Alliance or on Foxhall to hire a physician provider of terminations.
Separate and apart from the issue of reproductive services being offered at the Foxhall Ambulatory Surgical Center, there were to have been other procedures that would be available there. In fact, my recollection at the time of the formation of the Health Alliance is that reproductive health services would make up less than a tenth of the services being provided there. What's going on with the other 9/10 of the services that are going to be provided at FAST?
Maybe I can answer.
That'd be fine.
Most physicians or surgeons who did procedures and...
Doctor, can you move a little closer?
Sure. Or I could just speak louder, too. Pretty good at that. Most physicians or surgeons that do procedures like to have a organized schedule. And the less they can be spread out, the better. So if they have a choice not to go to multiple places and try and do it all in one place, that's what they'll do. They'll try and make their schedules simpler for themselves and for their patients instead of going from one place to the other. So in that case, if we were able to provide a place for them to do their procedures without going back and forth to Foxhall, the Benedictine OR, the Kingston OR, they would choose to do their procedures in one place, not in multiple places.
So the status is that those other services are currently not being provided at Foxhall either?
That's correct.
Okay, thank you. I have a bunch more questions, but I'm not, but you didn't come here to hear my questions. But thank you for the opportunity, and thank you for your indulgence in allowing me to ask those questions in advance. I know you signed up in a particular order, but what we've done is we've pulled our list from the past 3 forums, and if you've spoken before, you move to the back of the list. Depending on how many times you've spoken before, Margie, you go all the way to the end of the list. So far, you're going to be honored to close.
I'm ready.
I know you are. But with that in mind, and I apologize if you've spoken before and somehow or another you've escaped our notice and you get to speak, please don't let on. You'll just get everybody else really upset. Just pretend it's the first time you're speaking. And with that, I invite John Cranston onto the microphone. John, walk around that. Will you please?